Cataract is any opacity of the lens inside the eye. So the lens inside the eye is like a squashed ball which is used for focusing the light onto the back of the eye. When that lens becomes cloudy, it interferes with the light being focused onto the back, and that's when you develop cataracts. Cataracts can affect you in several ways. The most common form that cataracts will affect you is by reducing your general vision. So you'll notice that it's just getting progressively more difficult to see distant objects, or even having difficulty with reading, but also having difficulty with driving and having increasing glare and dazzle at night can indicate that cataracts are developing. The most common cause for cataract is an age-related change in the eye, but there are other conditions which can affect cataract development. Some people are born with cataracts and then that can develop as they grow older, but other conditions such as diabetes can also cause cataracts to come on at a faster rate. Cataracts generally are diagnosed by patients visiting their opticians who will notice that their vision is progressively getting more difficult to correct with spectacles. But patients may develop them and be symptomatic of them just by appreciating that things are becoming more difficult to read at night or having difficulty seeing bus numbers. Those are the sort of symptoms patients will be aware of with their cataracts. Cataract surgery is a process by which we can remove those cataracts and put a new artificial lens inside the eye. This is a procedure which involves making a very small incision just over 2 millimeters on the side of the eye. This is done under local anaesthetic, usually using drops alone, but also using some local anaesthetic inside of the eye at the beginning of the operation. Then through that small incision of just over 2 millimeters, we're able to take the cataracts out and implant a new lens into the position of where the old cataracts was. The decision on when to have cataract surgery is broadly based on 3 questions. The first one being, is there a cataract present and is it causing symptoms for you? The second one is, are all your visual symptoms attributable just to that cataract? And thirdly, do you want something doing about it? If the answer to all 3 of those is yes, then it's suitable to take the cataract off. There is no arbitrary cut-off period or cut-off vision for deciding when to have cataract surgery. At your consultation, I would take a detailed history, including a history of how your vision is affected by the cataracts, but also a history on general medical health and any medication that you may be taking at the same time, and any allergies which may be pertinent. After the history, I would then examine the eye, including a full dilated examination, looking at the front and the back of the eye to make sure that there are no other causes for your reduced vision. After that, diagnostic tests are carried out to look at what type of lens and what strength of lens will be required to go inside the eye. I can then discuss with you the types of lenses available. We can discuss whether to choose just a distance lens, a reading lens, a multifocal lens, or an extended depth of focus lens to help reduce your dependence on spectacles after the surgery. So the decision on what type of lens doesn't have to be taken immediately. It's a good idea to go away and think about it and to discuss it with somebody else, including talking to your optician, which is always a good source of information as to what they think may be deemed suitable for you. So long as we know what type of lens to have at least a week before the operation, then we can order the lenses in. But the more notice that we're given, the better. Please turn up at the appointed time, as turning up earlier will mean that we can't accommodate you, as we are quite busy and we have limited seating. So turning up at the allotted time will mean that you can have a personal, quiet period prior to having the surgery. It's common for patients to be in the clinic for between an hour and a half and 2 hours for their time of surgery. So this includes time waiting for the pupils to dilate and the time having the operation and going through with the nurse afterwards with regard to discharge medication and drops. Please do not drive on the day of the operation, as your pupils will be dilated and your vision will be blurred immediately after the operation. Vision will be blurred for approximately 48 hours after the operation, so don't be concerned that things seem a bit blurry for the first day or two. Cataract surgery is a painless operation. It is not a sensation-free operation, as you will be aware of pressure at times during the operation, which I will inform you when to expect. But as there is no pain associated with it, this operation is carried out while you're awake. I'll be talking to you throughout the operation. If you feel particularly anxious about it, there is medication that we can provide to help reduce that anxiety. But all operation is carried out as a local anaesthetic, is a day case, such that you'll only be with us for a minimum period of time. Please continue all medication, as there is a good clinical need for you to be on that medication, and there's no reason for you to stop any of your medication for cataract surgery. Please remove all makeup and accessories prior to the surgery, as we do use an iodine-based antiseptic to clean around the eye, and this works much better when there is no previous makeup or any other accessories such as false eyelashes. So please remove these prior to the surgery. Please remove contact lenses at least 1 week for soft contact lenses and 2 weeks for hard contact lenses prior to your consultation, as the diagnostic tests do require your cornea to adopt its natural shape. Contact lenses, however, can be worn up to the night before the operation, but please do not put them in on the day of the operation. Standard eye drops are prescribed following your cataract surgery. If you are only having one eye operated on, then this will be 1 drop of steroid drops to be used 4 times a day for 4 weeks. If you are having both eyes operated on, then that does include using 2 sets of drops, one of which will be 1 drop twice a day for 2 weeks, and then the other drop, which is a steroid drop, will be 1 drop 4 times a day for 4 weeks. The amount of drops that we prescribe should last the allocated 4 weeks' time. However, if you do run out of drops, then the options are to ask your general practitioner for a repeat prescription, or you can pop into the clinic and we can provide you with some extra eye drops. Following your cataract surgery, I will review you between 1 to 2 weeks to ensure that everything is progressing as planned. Following surgery, at your review appointment, it's okay to drive, as I will not be dilating your eyes. The incision following cataract surgery heals really quickly, so within 24-48 hours the incision is usually healed over. So we would suggest exercising caution really only in the first 5 days. So you can wash your face, but try to keep water away from the eyes in the first 2 days. After 5 days, carry on as normal. There is no further restrictions to take. Bending and lifting is okay, but just try not to do anything too heavy which would make you hold your breath and strain. Following surgery on the day, it's quite normal for your vision to be quite blurred, and this can take 24 to 48 hours to recover. Your discharge medication will be prescribed and dispensed by the nursing staff before you go home. Your vision will be blurred, so please ensure that you don't drive to your surgery appointment and that you do have someone to come and pick you up. It's entirely normal to have a bit of discomfort on the first night following surgery, in which case we'd recommend some paracetamol. Warning signs though to contact us would be increasing pain, reducing vision and increasing redness. These are all signs that there may be a problem with your eyesight, so please contact us on the emergency number provided. It's usual for your eyes to feel a bit gritty, and this will settle as you finish your eye drops. Following surgery, discomfort is quite usual in the first 24 hours. Following that, your eyes should feel more or less normal, although there may be a little bit of grittiness with the eye drops that we provide. It's usual to experience some visual phenomena following the surgery, such as noticing a black circle or black arc in the side of your vision, or even some shining, flashing lights. These are temporary and these will settle within the next 4 weeks. Following the surgery, it's a good idea to take it easy for about 5 days. The incision heals within 2 days, and really that's what we're waiting for to make sure that everything has settled and that you're out of the woods with regard to infection or any other problems. By leaving 5 days, you're ensuring that everything is settled and healed, and after 5 days you should be able to maintain your normal daily activities as usual. So in the first week, try not to do anything too strenuous which is going to make you hold your breath and strain. Otherwise, most activities are normal. Swimming, we would prefer you to leave for about 4 weeks, purely because with using the eye drops, your eyes can sting more than usual. Light cardiovascular is absolutely fine. After a week, normal sporting activities can be resumed. There is no restrictions on performing these after that 5 days to a week. So vision following cataract surgery will be blurred for between 24 to 48 hours. Usually, vision is good enough to be able to drive after 48 hours. But really we need to make sure that you can read the number plate at 20 metres. So if you feel as though you can read a number plate at 20 metres the following day or 2 days following surgery, then it's fine to drive. But please don't drive until you're aware that you can read the number plate at 20 metres. Following surgery, we would recommend waiting at least 4 weeks following the surgery. We really need to wait until you've finished your eye drops and then to see your optician following that. There is no restriction on flight following surgery, not for cataract surgery. You could fly the following day if you wanted to, but we would prefer you to remain in the locality for the first week, just to ensure that you don't have any problems. Complications from cataract surgery are rare. They are less than 1%. But those complications can include complications at the time of surgery and complications following surgery. Complications at the time of surgery you would be informed about at the time of the operation. But these just usually mean that it takes longer for you to get over. Complications following surgery include infection and bleeding. The highest risk of developing infection is really from day 2 to day 5, and that's when you would be aware of increasing pain, increasing redness and reducing vision. Please contact us immediately if you do experience any of those symptoms. One of the long-term complications that can occur is clouding of the capsule that the new lens goes into. You will be aware of this by the vision progressively getting more blurred at some stage, usually months if not a couple of years following surgery. Patients can feel as though they're developing symptoms of a cataract again with increasing glare and dazzle. Posterior capsule opacification, where this capsule clouds over, is very easily treated with a laser treatment. This laser treatment only needs to be carried out once, as the posterior capsule opacification does not recur, and it should bring your vision back to how it was approximately 4 weeks following your surgery.